I'm Khaled Najjar, Health, Safety, Environment Department Director. I would like to speak about the emergency or internal emergency procedures. Actually, we can brief it into two terms for fire and evacuation procedures. We are using the term RACE and PASS. RACE stands for rescue, activate, confine, and extinguish, or evacuate. So the first priority is to rescue our patient with the letter R. The second procedure is activate the alarm. Third procedure is confine the area or confine the fire. The fourth procedure is evacuate or extinguish. So let's have the rescue procedures in details. Our first priority, as we said, our patient. So we are trying to get our patient safe from the fire. We'll take him to a safe place, and mostly it is the assembly area. We have two assembly areas, primary one and secondary one. Primary one is all over the hospital in all units, and the secondary one is outside the building when you are going to evacuate the whole building. First, when you are going to rescue patients, we have to feel the door handle, then to be sure that there's no fire inside, it's not huge. Then we'll go inside the room and get our patient out, and then we'll confine that room by taking out the oxygen cylinders, and any flammable material could be there, and then we'll close the door and seal it very well with any towel, and preferably to be wet one. The second procedure is to activate the alarm. How to activate alarm? We have three means. First one, verbally, we'll shout that we have internal disaster or internal emergency, God forbidden. Second, by operating the fire alarm. And third, by calling the operator by dialing number 43 or 43. Then we need to confine the fire. Confine by closing doors, checking all other doors that no one was there, still there, and shutting off the oxygen valve, and that will be by the charge nurse permission. After that, we'll try to extinguish the fire using fire extinguishers, and we have a lot of maybe 3 or 4 fire extinguisher in place, and each fire class has its own fire extinguisher. Example, like electricity fires, we cannot use water, so we have to use CO2 fire extinguishers. The fuel fires, we cannot use also the water, so we'll use foam, either the powder. This is if we have a tiny fire, but if we have a huge one, so we have to evacuate because we are not firemen, so we'll evacuate the place using the evacuation plan in place in every patient room or every station. We have also a written preparedness plan. This plan mentioned the role of every staff. So don't worry, our staff are well trained for these emergencies. Let's go back to the evacuation. So when we are going to evacuate the place, we cannot use elevators. So we have to use the stairs. We have to go to the assembly point in each unit. And if we are requested to evacuate the building, so we'll take the stairs down to the secondary assembly point, which is outside the building. I hope that this informations are fruitful, and I hope that you are interested with this topic, and I hope that you are safe all the time. Thank you.